I've had a lot of experience with I've had horrible neck and shoulder pain in these last few years, and every time I go to my doctor, he just says that it's old age, and I'm too stuck on being young. And so I'd like him to know that, it has to do with my post-polio, not just arthritis. He's giving me several medications, Celebrex and spasm medicines, all kinds, and all I really needed was a good brace and then a good couch to sit on, and that really helped 80%. So, and just a lot of rest. And that's what I would like the doctors to know.
Polio is a serious disease caused by infection with one of two types of wild polio virus. The virus is spread through contact with food, water, or hands that are contaminated with the feces or throat secretions of an infected person. 72% of people who contract polio will not become seriously ill or realize that they are infectious. Symptoms vary from mild, flu-like symptoms to meningitis and crippling or life-threatening paralysis. In 1 to 2% of cases, polio affects the nervous system, resulting in paralysis of the arms, legs, or the diaphragm that assists with breathing. Between 2 and 5% of people who develop paralytic polio will die. Half of those who survive will have permanent paralysis. Most polio survivors believe that once their acute polio symptoms have receded, their struggle with polio had ended. Not necessarily true. 10 to 40 or even 50 years after the initial bout of polio, some polio survivors begin to suffer from further symptoms, including new weakness, joint and muscle pain, and fatigue. These symptoms are known as the late effects of polio, or Post Polio Syndrome. Not everyone who has had polio will develop post-polio syndrome, but approximately 20 to 40% of people who experience severe disease, especially those with paralysis, are more likely to develop those late effects. Dr. Robert Tello from Loveland, Colorado, talks about the latent effects of polio.
So a lot of physicians are not familiar with what post-polio syndrome is. Post-polio syndrome is a complex system of problems, primarily fatigue, pain, and muscle weakness in patients who had polio 20, 30, 40 years earlier in their life. It's really important that patients tell their doctors that they had polio, and it's important that physicians themselves be aware of what post-polio syndrome is. Post-polio syndrome can be a serious, debilitating syndrome in patients when they reach their 60s, 70s, and it has to be addressed appropriately. Physicians should realize, for instance, that every system in the body is involved because it's a neuromuscular disease. Being a neuromuscular disease, these patients have great difficulty not only in moving their extremities, but also in breathing. And because breathing is a mechanism involving abdominal muscles and diaphragm muscle, it's important that physicians try everything they can to not prescribe opiates or sedatives. Post-polio syndrome patients do not tolerate opiates and sedatives. If they have to have surgery, anesthesiologists need to keep in mind that these patients have a diffuse neuromuscular disease, and as such, that has a great deal of influence as to what type of anesthesia to use and how deep they can put the patient into a state of anesthesia.
My wife had polio when she was 2 months old, and I wish that the doctors and caregivers would believe what they're telling and not treat them like they were nuts. And it took a lot of work for her to get her doctors to finally start listening.
I had polio in 1964 in Manila, Philippines. And one thing that I wish that medical professionals know is that there are better braces than the polypropylene brace. Mine is the DBS brace, which changed my life. Before I got this brace, I was using a regular polypropylene AFO, and my arms were wearing out so badly, I used one forearm crutch, and I thought I would need to go to 2 crutches. in order to balance out the load, and so I don't overuse my one arm and use my scooter more. With this brace, I got rid of my scooter lift. I only use my scooter once in a while when I have to do some heavy walking.
Patients who have post polio syndrome will share symptoms with their primary care physician that could cause a physician to think of other types of diagnoses, such as fibromyalgia, multiple sclerosis, muscular dystrophy, ALS, or Lou Gehrig's disease, because there are so many diseases that cause muscle weakness and fatigue that post polio syndrome may not be something that the physician is going to think of initially, in part because we're not trained to have much of an understanding of post polio syndrome. But despite the physical problems associated with polio and with post polio, it is very important for survivors to have a positive image of themselves. It's important they get into a group of supporters who will give them support as they deal with their issues. There is an old Irish proverb that goes something like this: "May your home be too small for all of your friends." Friends are everything in life, and having post polio syndrome is no exception to this. And when you get down on yourself, for whatever reason, friends and family should be there to help you.
I'm the coordinator of the Post Polio group in Montana, and my only wish is that the new doctors that are coming up would get more education in the field of polio and post polio.
I would like my healthcare professional to know and understand more about respiratory problems with post-polio survivors.
I would like healthcare providers to be really brought up to snuff on issues of ventilation for people like me who had weakened diaphragms, on the issue of ventilating people who don't have underlying lung disease, but simply have weakened diaphragms, which means that they can take in oxygen and perfectly well, but they can't expel carbon dioxide. And my experiences in being given oxygen, which made me just confused and feeling very stupid, was a disaster. Being put on a CPAP, which stands for continuous pressure flow, the continuous pressure was too difficult for breathing out. I felt as if I was being smothered by a pillow. With the BiPAP, the pressures vary, so for inspiration you get a little bit more air than you normally would. Expiration, it reduces the pressure so that a person with a weakened respiratory system can breathe out. And that has been a wonderful thing for me and allowed me to start dreaming again. It's eliminated my sleep apnea and made me feel much better.
I had polio when I was 9. What I would like doctors, physical therapists, orthotists, people working with polio to realize is that there are innovations in treatment available to all polio survivors, and that we need to be more aware of the fact that our global economy is going to impact us, because there are going to be people coming here from countries where polio continues to exist and going to be needing treatment, and they are going to be younger than those of us who had it back in the 50s. So keep your mind open to innovations and to changes in ways of treatment that you haven't been exposed to in the past.
If you have post-polio syndrome, tell your physician, seek out a support group, and find the means to make your quality of life the best it can be. I'm Scott Wheeler. Stay healthy and happy.